Three's a charm.
All right, guys. Sorry about that. Had a little technical difficulties there. So Dr. Bob's back, and we were just talking a little bit about autoimmune. We get a lot of questions about hair loss after COVID and any of these different issues. So we were thinking, it could be you want to check your autoimmune thyroid markers. So you want to check your TPO and your thyroglobulin. A lot of people, I'll ask them, hey, which type of Hashimoto's do you have? And they go, I don't know. They just said I have Hashimoto's, but it's really important to know which type of Hashimoto's you have. They both can cause hair loss. That's one of the common things. So, that's something that I've seen both, like you were saying, with the shot and with getting COVID. Spike protein somehow, some way can rev up that immune response, can rev up that inflammatory process. So if you've had a rough case of COVID, if you've had the shot, getting some antibody tests done is a really good thing to do just to check that inflammation. I would check C-reactive protein, check your homocysteine, your ANA, your Hashimoto's antibodies, anything else. I know D-dimer, some people are testing. Anything else you like to look at post-infection or anything else?
You mentioned D-dimer. That's a good one. It's a little more expensive. I just simply do a prothrombin time with international normalized ratio. Let's see what the clotting is doing. Less expensive, easier, and ultimately, most of my patients have finite means. And the better picture we can get most cost effectively, the more they can put into getting better. But we do need to know what's going on, right? If we're not assessing, we're guessing. And I love the comprehensive. We certainly have the same mindset when it comes to labs. We need to know enough to help the patient thoroughly.
Yeah, and that's the hard part in functional medicine. Some people go way the other way, and they're dropping food allergy, and they're dropping their Dutch test, and they're checking for mold and Lyme, and all of a sudden it's $3,000 or $4,000 later, and I'm like, holy cow, we could have think of the treatment we could have done for that amount. And so that's one thing I learned from you guys way back in the day was if you're testing, it better be a needle mover. It better be, changing the course of your treatment. But, even with a food allergy test, I tell a lot of people, we don't do on a regular basis. We don't do a food allergy test on day one because they'll come back with 40 different
freezing
foods.
Again. Interesting day with this.
Can you hear me?
Now I do.
Okay, so we'll see on that food allergy test like 40 different foods that come back on day one, and you're like, how do I stay away from spinach and lettuce and oysters and whatever else? And so, but for me, my first thought is, man, their gut is in bad shape. And their immune system is revving up, and it's creating this inflammatory process. So no matter what, we're going to have to dig into the gut, and then down the road, if we still need to, we'll run a food allergy test. I always say if I could only run one marker on everybody. And I'll love to hear what yours is. If I could only run one blood test, it would be ferritin. That would be my favorite. What? And I'll tell you in a second why. But what would your one test if you could? That's all you could do.
Well, it's definitely going to be an inflammatory marker. Do you go with high sensitivity C-reactive protein or ferritin? I'd like to know why you go with ferritin. I might go HSCRP, but go for it.
Yeah, so ferritin, I like because we get actually both sides of it. You obviously, our ranges. If you look at the lab range, 400 for some of the labs and things like that. I'm more on the 125 for females, 150 for males. So over that 150, 200 range, it's not just hemochromatosis. Obviously, just go give blood. That's what people think. But 99.9% of the time, if you see that ferritin significantly high, especially over 200, you're going to see triglycerides up. You're going to see that CRP high. You're going to see insulin resistance, potentially high GGT and fatty liver. This whole metabolic cascade. So that's one side of it. But the other, if you see under 40, especially under 30, 20, then what are you thinking? You're thinking, leaky gut, malabsorption, not getting enough nutrients. Maybe heavy bleeding cycles, some of that. But a lot of times it's gut based. So that I always like to think if there was just one thing I could do on everybody, if FDA came in and said you only get to run one test, what would it be? So
You make a good argument for that one, and I'll give you the nod on that.
Yeah, awesome. So tell me what you're what you're telling your patients to have on hand when they get that diagnosis, when they get that COVID diagnosis.
Well, the big five. Now, I've listened to a bunch of immunologists, and had a 100 plus patients that have all done well. I like colostrum as passive immunity, super powerful. I like zinc as antiviral replicator. I like the reishi or Ganoderma lucidum. One, it actually enhances neutrophils and natural killer cells and modulates the inflammatory process and has direct antiviral action. Then we're going to go with our vitamin D, and we go with quercetin. And those are all proven and effective.
Yeah, awesome. Tell me about the reishi. What source do you get for that? Where?
Well, I'll disclose a potential conflict of interest. I'm an investor in a reishi company.
Okay.
All USDA certified organic reishi, and we certainly have capsules. Whether you want the spores, the most potent mycelium, or the lucidum, but it's also infused in coffee and tea, and that makes it a no-brainer. People just switch their brand and they get multiple doses a day. And it's been powerful. It's a great way to enhance.
So even in a capsule form, they don't sit there and eat the mushrooms themselves.
Well, no.
Yeah.
Very bitter mushroom. Yep.
Yeah. So we'll get to this question. They didn't hear us respond to this one. So the pain in the legs. Dr. Bob was talking about the inflammatory process, and almost look at it like a neuropathy case. So somebody with diabetic neuropathy, post cancer treatment neuropathy, look at those nerve cells. And so remember, what do nerves need to function optimally, and especially even the brain? We need oxygen, we need glucose, and we need activation. So we talked about blood sugar earlier. You've got to keep that blood sugar as steady as possible. Oxygen, that's another great part with ferritin, is if that's low, and then you're not going to be getting oxygen to your nerve tissues, to your brain. So you need to know if you're anemic at all, make sure that you're getting that oxygen to your tissues. And then you've got activation. And so activation is going to be that stimulation. Get a wobble board and stand on that while you're brushing your teeth. Those little inflatable discs that you can stand on, the vibration plates, as much stimulation. I love the massage gun. Do you have one of those, Bob? Yeah. So just sit on there. You can do arms, legs, everything, but get on your feet, get on your calves, and just boom, 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 boom. Get as much stimulation. Any other tips that somebody can do at home?
Well, you covered it. And since that was a repeat question for diabetic neuropathy, we use lipoic acid, carnitine, resveratrol, and reishi. And we've seen, limb saving resolutions.
Yeah, absolutely. So, just like hair loss, we've got this inflammatory process, probably that somehow those spike proteins, whatever it was, but, again, we don't know what they did in that lab to that virus, over in Wuhan and all those things. But, it's not, this isn't some just natural thing that if you've had this virus, it doesn't feel natural and normal. And so it's creating these other inflammatory processes, a bunch of different things. So, when people ask about even detoxing after, them getting their shot or whatever, I don't even see it so much as a traditional detox as more of a, how do we get that inflammation down? Because we've seen C-reactive protein, post infection or post, getting these spike proteins in the body where, we'll see it go from 3 to 30. And some pretty high stuff. So I see it just as much of a detox as it is a calm down that inflammatory process.
And for what it's worth, what I've seen is that the younger the patient, the worse the response. So you've got people like Robert Malone saying, you better look at risk benefit. And if you're young, the risk is the shot, not the virus.
Yeah, and that's a whole nother conversation. He had a great interview with Joe Rogan. That was really good. So Karen had a question here. Can I take melatonin with asthma?
You probably should. And so what we're looking at here, melatonin there's a lot of research over the last handful of years. It's a powerful anti-cancer molecule as a cortisol modulator. It helps your cortisol work better. And asthma is defined as a silent inflammatory condition of the airways. We control that inflammatory process, the allergy reaction, the immune response, and we can often, get nice improvements there.
Yeah, absolutely. And melatonin is one of those things with COVID, those early treatments where getting that good deep quality sleep, especially if somebody goes to the hospital and then they start getting stressed and nobody can come see them and they're sitting there all day by themselves and they're having a hard time breathing and everything's beeping and all that. So even some heavy duty like 10 milligrams of melatonin can be very beneficial for somebody just to calm that down. So that's definitely one of those things to have in your kit. Even obviously we're always on the side of natural's better, but in this case, having some aspirin on hand, there's things, yes, we can do naturally, and yet, a couple days of aspirin to prevent some of those little microclots that are forming. That's not going to kill you. That's not going to destroy your gut. And yet, if you're in that potential risk category and everything else, I'm all about pulling out what we need to, and just like Dr. Malone said, taking Pepsid and doing these other things. Yes, there are natural alternatives, but sometimes we combine both sides, and short term, we'll pick up the pieces. I had 2 bullseye tick bites probably 15 years ago, and I did about 3 months of antibiotics, and it brought out the full blown. My gut will probably never be the same, but I did not ever have Lyme symptoms, thank God. And so, that's 2 years down the road. You don't want to be giving antibiotics all the time, and so there's time and place for everything. Let's see if we can get a couple more questions here.
Dr. Ben, I want to mention that I'm eager to see the studies on how ivermectin may impact Lyme's, because that appears to be an intracellular parasite. So that could be, another use for that wonderful medication.
Yeah. So here's Angel, one question. What's protocol if you're sick, don't have the vaccine, Epstein-Barr, not out for a long time, but hypothyroid? So, this is somebody that's already kind of depleted. They've had Epstein-Barr probably throughout their life, and they're just kind of depleted. They're already hypothyroid, probably Hashimoto's. If they haven't tested, they should probably get tested. But, in that moment, for those people that are just kind of already run down and depleted, anything different in that time?
Well, I tell people the enemies of the immune system are stress and sugar. And so we want to minimize both of those. So that's stress reset, melatonin, theanine, reishi spores. Those are really good options there. And then we've got our immune support, just like we described for COVID. Epstein-Barr is a virus. So we go with those big 5 again: the colostrum, the zinc, the D3, the reishi, and the quercetin. And, it's about half of our population will test positive for Epstein-Barr antibodies. So, half of us have been infected. So
it's a lot. And that's one of the big things we're seeing with this long COVID is that reactivation of the Epstein-Barr. Pretty, it's a high number. One study I saw, it was the majority of people that had long COVID. Actually, it was that reactivated Epstein-Barr. Anne asked a question here, and you're feeling about taking the preventative vitamin zinc, quercetin, all of those in small doses, and then load up. Do you have people like cycle off and on, or just you can take a quercetin a day, take 25 to 50 milligrams of zinc a day, and then load it up if you need to?
Sure. So, a simple rule is once you at least have a good baseline of having taken it, 6 days on, 1 day off, 6 weeks on, 1 week off, let your body reset a bit. But I tell people bodies respond to frequency, duration, intensity, quality, and timing of stimuli. And I'll often dose things every waking hour when they're dealing with a crisis. Now, when we start talking about zinc, it's, for a lot of people, it's not too gut friendly. So you might want to take it with a few bites of food, and then it goes down a little nicer. But, these things are first do no harm. And when we do zinc tests in the office, about 19 of 20 people are seriously zinc deficient. So that's something you can probably pick up for an extended period of time.
Yeah, and that's something we've talked about before is the zinc tally, where you actually have the liquid, and it should taste pretty darn yucky when you drink that one, and that's a great way to be able to tell. Let's do one more, and no, that one. Okay, Carolyn, I read that Manos helps. That's found in leeks. Have you heard this? Manos, Manos is great for chronic urinary tract infections and some different things that way. So, but I haven't heard that for COVID. I'm not sure what that
Well,
would.
it gets absorbed. It does, like you said about the urinary tract, it blocks bacterial adhesion in the inside of the bladder lining. It wouldn't make my top five, that's for sure. It'd be
Yeah,
much
yeah,
further down the list.
I would definitely put my money other places. So, Dr. Bob, sorry about the technical difficulties. We will have you on again. You're just such a wealth of knowledge. We've got again, you've seen people all over the world. They love listening and learning, and so we will definitely bring you back on. You're such an inspiration. If you haven't followed Dr. Bob on Facebook or social media anywhere, every time he talks, it's that smile. It's just that ray of hope that we need in this world, talking, from that positivity perspective that we need. So any last minute hits you want to leave everybody with and send them off on a great day?
I lectured at a conference years ago, and there was an 8-time world champion that was a keynote speaker. And someone asked him, how is it that you have so much energy? And I loved his answer. The only way you have energy is to earn energy. Well, let's just take that a step further. The only way you have health is to earn health. I call them the Magnificent Seven: eat right, drink right, think right, move right, sleep right, poop right, talk right every day. And let's make this a beautiful life. The world needs us right now.
Absolutely. And that is so true. That's what I love about people that jump on this page. We don't even really have to moderate it. People are positive. People are giving supportive answers and, giving ideas of different things. Even before we have a chance to answer a question, people are jumping in 2-3 times down the road there and giving suggestions and just helping people out. That's what we need. I don't care what political spectrum somebody is under. I don't care, where they align with anything else, as long as we're in this together. We're looking at how can we get our bodies as strong as possible, our immune systems as strong as possible, and the more connected we are. I love the thought it's all about relationships, and the better our relationships are, the better our health is. Study after study shows that. And so anything you can do today to connect and have a better relationship with those around you, your health is going to improve.
I agree. Thanks for
All
having
right,
me.
guys.
I enjoyed it.
Yes, take care. Thanks so much for jumping on, everybody.